Our Eva is a 13-and-a-half-year-old chocolate delicious lab, was diagnosed in October of 2019 with a nasal tumor.
And she had nosebleeds, and coming out of one side of her nostril. And on CT scan, they found a space-occupying mass that was pretty obviously of a soft tissue density. And at that time, that obviously instigated a biopsy, and the biopsy came back with a diagnosis of nasal chondrosarcoma.
I wanted to try the treatment, and I was pretty positive through the whole thing. We recognized quickly that we were dealing with both competence and compassion.
So in terms of cancer treatments, there's a lot of doctors that are involved, such as surgical oncologists, radiation oncologists, medical oncologists, radiation therapists, and all. And we all have separate roles we play, but as a team, we're able to make cancer treatments a lot easier for patients and also be able to figure out a plan that would best fit that patient as well.
A medical oncologist is your conduit to so many cancer therapies, right? A patient would come in to see us to learn about the biologic behavior of cancer, who it affects, perhaps why your dog or cat got that type of cancer, and then the different things that we can do about it. It might mean surgery, it might mean chemotherapy, it might mean radiation therapy, or it might be a combination of all those things. And the medical oncologist will help you to sort through that. And then they'll also help to guide you to the radiation oncologist or the surgeon.
The radiation oncologist creates the plan that allows us to treat the patient, which entails, them doing the contouring and the planning of how much dose would be delivered to the patient. The radiation therapist does deliver that amount to the patient themselves, but we also do some quality assurance to make sure that what the radiation oncologist created matches up to what we'll be treating for the patient as well.
I always try to talk about side effects, which thankfully are very minimal, but a radiation oncologist would review those as well. And then to try to give them a realistic hope of what to expect, how quickly the radiation can reduce the mass, and how long the radiation can keep the cancer away.
We've been doing stereotactic for nasal cancer long enough to know that the survival times that we're seeing are equivalent to, if not better than, what we could accomplish old school. Side effects are so much less that I personally have not treated a nasal tumor patient with conventional fractionation in probably a decade.
What I've said many times, in fact, to clients with pets in dealing with cancer, and particularly pets that are looking at radiation, is that it's not painful. It is something where your pet is going to have excellent quality of life during treatment, and you have the expectation of extending that life. It doesn't always work, but it's absolutely worth taking that risk because your pet is going to be happy going through treatment, and that is going to put you or me, and it did, at ease.
I think having Eva come up on 3 years post-treatment is probably one of the coolest things to hear, We don't see very many owners that come back that say, hey, I've done this many recheck CTs and all that, but having a patient that's gone 3 years and's been doing well, there's nothing more that we could ask for. It's probably one of our, best moments in terms of all of the patients so far.
When we think about Eva's outcome, she has beaten our median, so that makes her, that puts her in the top 50%. And the real question becomes, once you clear the median, you have a patient that has probably responded better than your expectation or better than the quote unquote average patient would. And the sky is really the limit in those patients once they clear the median. But when you get a patient that exceeds your expectations and that gets back to a normal life and a normal life with their family, that's the whole reason you do what you do.
So something that they need to know, and I think is very important, is that if you hear that your dog or cat or companion animal is diagnosed with cancer, it doesn't mean that's it, that there's no options. There's a lot of options out there.
The major message for a family would be don't despair. Information is your friend. Try to find out everything you can about options that are available. And then at the end of the day, pick the option that feels right to you.
I have absolutely loved working with PetCure for many different reasons. The first is I truly believe in their philosophy, right? They want to always be on the forefront, trying to do the best radiation that they can for all the animals involved. And it's still an early science, so it's important to have studies, to learn, and to make improvements. And they are 100% on board with doing this.
The level of commitment that it takes to get your pet through a course of radiation therapy is pretty significant. And I think our desire is to match that commitment stride for stride.
There are not enough good things to say about PetCure Oncology. They saved my dog's life.